everybody. We have a really outstanding panel today and to talk about a really timely, relevant, and important topic. So can't wait to get to it. Let me begin with one data point that I think is good news. 62 million workers in the United States of America are covered with paid medical leave through private insurers. So that's the good news. But that's only half. That's the challenge. And that's a lot about what we're going to talk about today, because obviously we need to do better. Americans should not have to be concerned about taking time off work to recover from an injury, manage an illness, take care of a loved one without having to and worry about their finances and what's going to happen to their family's financial security. When workers get sick or injured, they shouldn't have to decide between prioritizing their health or their paycheck, between taking care of their family members or earning income. Really, this topic and this need of paid medical and family leave is so important to family financial security. And as we know, those are particularly acute needs for women, for Black and Brown Americans, for low-income workers. Allow me to introduce the panel. First, we have Delaware State Senator Sarah McBride. Senator McBride has long supported expanding paid family and medical leave through legislation and has proposed a bill to address family medical leave in Delaware. Also on our panel is Amy Friedrich, president of U.S. Insurance Solutions with Principal Financial Group. Amy oversees coverage for nearly 100,000 employees and more than 3.5 million people. She has unparalleled insight on the private sector's ability to help expand paid leave benefits. And to round out our panel, we have Adrienne Schweer, who leads the Paid Family Leave Task Force at the Bipartisan Policy Center. Adrienne has worked across the aisle to shape policy and help elevate stories that illustrate how paid family and medical leave is good for business. We'll talk about the roles, the private sector, public sector, both state and federal, and then solutions. But let's begin with the human need. So I'll start with Senator McBride. What are you hearing from constituents at home?
You know, from the start of my campaign, I was just elected back in November of 2020. I said that I wanted to be the paid family and medical leave senator, that this was going to be an issue that I was going to champion, both because it was an issue that I was hearing about from my neighbors, but also because it's an issue that's near and dear to my own heart. When I was 23 years old, I met and fell in love with an incredible man named Andrew Cray. And about a year and a half into our relationship, Andy was diagnosed with cancer. He was lucky he had health insurance, and I was lucky because I was working at a place of employment that offered me paid time off to serve as Andy's primary caregiver. He underwent significant treatment, radiation, chemotherapy, surgery that left him needing to relearn how to talk, how to eat, even how to breathe. And because I was able to access workplace policies that were inclusive of our needs, I was able to be there by his side through that incredibly challenging time. He was lucky enough to get a clean bill of health, but then only 8 months later, he received the news that every single cancer patient fears. His cancer was back, it had spread, and for him, it was terminal. And because both of us had access to workplace policies that allowed us to take time off without sacrificing our income, we were able to spend precious time together in what ended up being just the last 4 weeks of his life. We were able to marry on the rooftop of our apartment building. And I was able to be there by his side, holding his hand just 4 days later when he passed away. And so for me, this is a deeply personal issue. And despite the fact that Andy is no longer with me, I know how lucky both of us were. We were lucky because he had health insurance, and we were both lucky because we both had access to paid leave. But I know, as you mentioned, that far too many Americans don't have access to these life-saving benefits. As you mentioned, roughly half of American workers still don't have access to paid medical leave. And according to the Bureau of Labor Statistics, roughly 25% of Americans, only 25% of Americans have access to paid family leave. And here in Delaware, a majority of our workers don't even have access to unpaid leave. And that needs to change, because the reality is, as my life indicates, the alternative of not being able to be there by my loved one's side is cruel and it's unsustainable. And I think this conversation is so timely, not just because of the discussion in Congress, but because the pandemic has really brought to the forefront these issues and these needs. We have seen, of course, the pandemic has reinforced that we have to provide the kind of support for parents to care for a child, for adults to care for an elderly parent. But I also think we've seen very clearly that the principle that no one should be forced to give up their income in the face of illness, that principle was something we upheld during the course of the pandemic. But whether it's a global public health crisis or an individual health crisis, that principle applies. And so this is our moment to really learn the lessons of the last year and a half, and to ensure that we put forward a comprehensive proposal that never requires anyone to have to face that choice.
Well, thank you for sharing such a deeply personal story, and a powerful one, and framing perfectly what we're all about here. This is a vital topic. And I'll turn to Amy. You listen to that from the perspective of someone who's working closely with employers, those very employers that the senator was fortunate enough to take advantage of the policy. How do you respond to that, and how do you think about that from the standpoint of employers' ability to address the needs that are out there?
So I echo the thanks for a great introduction to this topic. It is near and dear to my heart as well. I think sometimes when you reach over into the private industry, I think we think that we leave sort of emotions or our families or our intrinsic sort of histories at the table. And what I can say is that employers, particularly small employers, feel intrinsically connected to their employees. And so they are saying to us time and time and time again, we want to offer this benefit. At a personal level, this is also personal for me. My husband was still in school. I was the only breadwinner when I had both of my children, and I needed income protected leave to keep the family running. And so, those are days long past. My kids are teenagers now, but I needed the comfort of the employer who'd help make the decision around income protected leave. Let's start with that. Let's start with the assumption that employers are looking for answers. They know critically, especially small employers know, they know every person who works on the team, and they know often their family situation. So when we ask those small employers things like, would something like an income protected leave product like short-term disability be affordable? They're actually giving us information that says they think it's going to cost 10 times what it would actually cost. So instead of something being $200, they literally think it's going to cost them $2,000. So the information, the lack of good information, the lack of good education, the lack of good context for how income protected leave can be available and how public and private industries can work together, I think we are at a tipping point at getting after that. And I speak for my insurance industry peers, at least as who are part of ACLI, in saying we stand ready. We do income protected leave administration, record keeping. We work with HR departments. We work with employers. We are ready to help us fill this gap. But man, we all got to start from a point that we want to actually work together on this. Business owners, particularly small business owners, they want help. So we got to help them.
So you speak to a tipping point, and that the need was there before the pandemic, but it does seem, what we all know, that COVID really has exacerbated the need, and it's particularly had an impact on women. Amy, Senator Adrienne, speak to that from your experience in terms of just, sharply focus us on how COVID has created the tipping point.
Well, we have, in the work that we've been doing at the Bipartisan Policy Center, we've been trying to illuminate what paid family leave is and what we're talking about. And in many cases, I think that's part of the delta in conversation. So, almost 30 years ago, Congress passed this law called the Family and Medical Leave Act, FMLA, which is unpaid leave for workers who meet certain qualifications. And it covers parental leave, having a new baby, or adoption or birth or adoption. It covers family caregiving, like Senator McBride's story, and it covers personal medical leave. But only 60% of Americans are covered with FMLA, and there's a huge percentage of our country workers who are not. And those are often lower wage workers, part-time workers, workers who haven't been in their job as long. Or interestingly, I find this one the most fascinating. One of the little curves of that law is that if you don't live within 50 miles of your employer, you don't qualify for FMLA. And in today's decentralized workplace, where so many people are lucky enough to work from home, there's a lot of people not living within 50 miles of their employer today. So, that's this aged, older law that needs to be modified and gets you the unpaid leave. But, Amy, you really talked about what we're talking about here is the paid component, the protection of your wages, because most Americans can't take unpaid leave, even if they're qualified, because they can't miss that many paychecks and they can't afford their family life without that. They can't put food on the table. And that's a really big challenge for a lot of American workers. When I started doing this work 7 or 8 years ago, 13% of Americans had access to a defined paid family leave benefit, that statistic that Senator McBride talked about. And today we've crossed it over the 20%, nearing 25% have access to a defined paid family leave benefit, which is a tricky way that BLS measures that, but that's progress. It's not perfect progress. It's actually not that good if you think about how much momentum there's been and how high profile it's been. And Susan, I think you and Amy both commented on the fact that a lot of workers are lucky enough to have paid medical leave through short-term disability and insurance products provided by their employer. In fact, almost 50%. But that leaves out 50% of people who this last year realized that they don't have that benefit and recognize the reality that they could be struck by severe illness at any point. And that has created this national conversation around paid family leave that I think was bubbling before the pandemic, but came to fruition during the pandemic. And we have a long way to go.
Well, that's, another part of the tipping point is the American public. Tipping point, as we know in politics, is when the American public starts saying, wow, this is a problem and it really needs to get taken care of. And there's research that says there's bipartisan support on both sides of the aisle amongst the public. Voters from both parties support paid leave programs to the tune of 84%. Overall, 96% Democrats and 74% of Republicans. I don't know of many issues that give us that kind of comity and bipartisan support. So, Senator McBride, I'll ask you first, sort of what are you hearing from both sides of the aisle? And then Adrienne, I'll go to you because, again, bipartisan's in the name on the door, and you guys are the specialists in this. But Senator McBride.
The legislation that I've introduced in Delaware would provide a default state-administered insurance program, but also ensure that there's an option for these private plans to be offered at equal generosity or even greater generosity to the state program. And one of the things when we're talking about these types of policies is that they're a win-win-win. They're a win for families, they're a win for businesses, and they're a win from the perspective of public support across the aisle. You cited incredible polling that demonstrates the broad base of support for these kinds of policies, because at the end of the day, paid leave's not ideological. When you're having a kid, that is not informed by whether you're a Democrat or a Republican. When you're facing cancer, that doesn't matter. It doesn't matter whether you're a Democrat or Republican. These are universal human needs. Paid leave is something that impacts at some point everyone in their lives, even if you don't start a family. This is a policy that is truly universal, and I think the numbers reflect that. And in the 10 states, and I include DC in that list, that have passed statewide policies around paid leave, in many places, it's not just a bipartisan vote.
Adrienne, what's your perspective?
Over the last couple of years, we have seen 3 federal laws around paid family leave come together in a bipartisan way. So first, to set an example, as the largest employer in the country, the federal government established a paid parental leave law for the 1.2 million workers that work for the federal government, and they can now have 12 weeks of paid parental leave. They also came together during the Tax Cuts and Jobs Act and created a pilot program, which is a tax credit for employers to offer paid family leave. And then lastly, during the pandemic, the first major relief law that the country put together, that legislators put together, called the Families First Coronavirus Response Act, had a huge component, an emergency paid family leave law that helped employers with less than 500 employees kind of bridge this moment and offer paid leave for workers who had a caregiving requirement that Amy talked about, with where schools were closed or needed to care for a loved one who was suffering from coronavirus. Those kind of bipartisan engagements where Congress came together from two sides of the aisle, they've done it 3 times. It's not a massive comprehensive law like Senator McBride talked about, but it's not nothing considering that 7 years ago there was one single Republican that would even talk about it and only one Democratic proposal. So I think there's been a lot of bipartisan momentum at the federal level. I think a lot of that momentum has happened because of the work that state legislators like Senator McBride have done to push state law. As she mentioned, there are 10 states or localities that have now passed paid family leave, even more cities. And that's put a lot of pressure because it's created quite a complicated patchwork for employers who are trying to navigate all of these complicated local laws and federal laws. And that's, taken organizations like the Chamber from being absolutely no on paid leave to, we want to work with you on it. We want to be part of the process. So I think there's been a big change, a big willingness that goes beyond that.
So I think the panel is saying the need is clear, and there's awareness of that on both sides of the aisle at the state and federal level. So that's the good news. Now we get into where some of the sticking points become. And I think you alluded to this, Senator McBride. It's sort of, what's the role of government? What's the cost? What's the role of the private sector? So I'll first go to our private sector leader here to get your perspective on how does it work from the private sector, and then come back to our other experts here.
Sure. So probably one of the most frustrating sort of headed into the door to talk to people who are at kind of have a lawmaking set of capabilities is that they'll say, okay, we asked how many people had paid family leave in our state, and we got a number somewhere between 11% or 19 or 20%. And I said, did you ask employers who were providing income protected leave? Did you ask that question? And they're like, no, this is about paid family leave. And I'm like, okay, but paid family and medical leave is really kind of a broad sort of subset of things that we have. Again, we're dealing with insurance companies and labels that came from insurance department oversight 40 and 50 years ago. So a lot of them are called disability insurance, short-term disability insurance. But what they practically do is they say for a certain period of time, we're going to cover if you're not able to be at work for a medical reason. At any given point in time, probably somewhere between 22 to 25% of any insurer who's in this particular industry, those claims, those people who are out drawing an income benefit are going to have maternity leave as the reason that they're doing that. Mm-hmm. So what we've done as an industry is we've developed a really great set of practices about, looking ahead for high-risk pregnancies, having to help people understand this is what you might expect when we see this at this point. We have programs developed towards understanding, getting people back to work, other caregiving, integrating into employee assistance programs that can give them childcare options. So we've developed a pretty sophisticated set of capabilities around maternity leave that are sort of unfortunately under this broad umbrella of disability leave. I think that's what the private industry has been doing for years and years and years. Now, I would say a failing from the private industry, and again, I'm speaking for myself here, has been that we typically relied on HR departments, so the human resources departments that are literally not present sometimes with small employers. So if you only employ 20 people, you probably don't have an HR specialist who's dedicated at looking at benefits. A lot of our programs work really, really well when you're interfacing with an HR program. And again, I think we should try not to displace those. But what that means we have to do is we have to get better at working with situations where you might be working with actually the business owner, because they're the one who knows everybody on staff. And you're going to say something like, can you give us your census file? And they're going to go, you mean my employee list? We've got to have more accessible language. We've got to help people understand what these benefits provide. And we've got to do a better job making sense. I mentioned that stat that just blew my mind. When we asked small business owners how much these benefits would cost in the private market, they gave us a number that was 10 times what the true cost was. So again, they don't have an HR department to run that by. So we have got to get better and more efficient and more effective as an industry, figuring out how to get together the sort of accessibility point and the interaction point, and then make sure we're doing everything we can to keep those costs low so that they are accessible for everyone. So I think there's work to do on the private side, but man, there's a ton of ground there to start from.
And so, Senator McBride, you listened to that. I know you've delved into the role of the private sector and then what government needs to do. And one of the areas of need, I think, from a policy standpoint, tends to be with smaller employers, right? That those who have the benefit of working for a larger company will have these kind of benefits. It's smaller employers, it's part-time workers. And Amy's alluded to this, that the costs aren't as high as they think. But that's when, from a policymaker standpoint, that's what you're trying to resolve to the greatest degree possible.
Yeah, that's a great point. And one of the things that I always say when I'm having this conversation with representatives from the business community who are concerned about the toll this takes on small business is that really at the end of the day, this kind of policy is a boon for small businesses. One, in the states that have passed these types of policies, in California, for instance, 90% of businesses report that their paid leave program has little or no impact on their bottom line. And actually, small businesses were more likely than large businesses to report that it had a positive impact on their bottom line. And that goes directly to what Amy was talking about. Right now, the current system is a system that is relatively easy to navigate and adopt for larger employers that both have these larger HR departments and employers that have the level of revenue that allows them to prioritize these types of policies. I, of course, believe that every employer should be prioritizing these policies on their own volition, but those larger employers are able to do so because of that larger revenue stream in most instances. But the reality is we have to level that playing field for small businesses. As we've talked about, this is a critical policy when it comes to recruitment and retention for employees. Now, I do believe that the private sector is an important part of the solution. There's a reason why 80% of the states that have passed these policies continue to have a private sector option. One is that when we're talking about this fierce competition for talent, when you have a default government option, you're going to be increasing the floor. And that means that these businesses that are going to want to recruit and retain talent are going to want policies that are even more generous than the state insurance program. And similarly, a number of these businesses are already providing these benefits, as we've talked about. And as I worked on my bill, one of the top things I heard from those businesses was, well, I have a plan. I want to keep it. I have a great medical leave, disability insurance policy. I want to keep it. I want that continuity. And so by allowing folks to opt out of the default and continue to provide those policies through the private marketplace, we're ensuring continuity for those who are already ahead of the curve. And also, I think, creating a marketplace that continues to innovate to drive down costs, but even more importantly, provide even more generous benefits than what we would create with a state floor.
Yeah. All right, Amy, you've gone up to you've mentioned this several times, and it is a myth we want to debunk out there that the cost of this is prohibitive or that we don't work with small employers. So respond more and help us all understand what's already happening for small businesses and what could happen with the right policy incentive.
What people are talking about are the scariest, most catastrophic times in their lives. We've got so much common ground there. I think the piece that gets missed still a little bit is that for those that do have income protected leave in place, which is again almost kind of 50% of that picture, that income protected leave isn't just limited to the paid family medical leave timeframe. That's going to be something that a lot of plans are going to have up to 26 weeks. A lot of the plans are going to say, okay, you happen to have had a maternity event in January and February and March, but in November, you actually had an accident. So private plans are going to allow for that income protected leave because it's going to be based on you had an event where you couldn't work, sort of regardless of what the 12-month calendar said. So that's the other piece of it as well, is that when we think about how employers want to protect, they don't just want to protect for one period of time. They actually want to protect the paycheck almost regardless of what the reason and what the happenstance of the cadence was on if those happened within 6 months or 12 months or 9 months of each other. So those are the pieces that we're finding the most relevant to get out there. And I think what I'm seeing now, though, is people are going back to business owners. They are asking them for their opinions, and they're having a really great voice in state discussion.
So, Adrienne, you alluded to the U.S. Chamber, and they represent a lot of small and large employers. And I know you're tuned in to, I think you did some research several years ago with millennial small business owners to just see how they came down on this issue. What's your perspective?
So I have so many different views here, and they might come off as a little confusing. I agree with almost all of what was said. I think that the challenges facing businesses today look very different than 6 months ago and very different than 2 years ago. And I think all of us are seeing as we go into a restaurant or to the grocery store is that there is a labor force problem right now. We have a lot of people sitting on the sidelines. We have had a lot of people sitting on the sidelines even before that, primarily women who were forced out of the workforce because of their caregiving responsibilities. And I'll just start there by saying, these are the challenges that have been with us for a while. Everyone on this call has heard about the challenges with women in STEM, right? Women in these kind of math, science, technology, engineering fields. Well, 2 out of 5 women pre-pandemic left the workforce right after having a baby because their employers don't offer paid leave and they don't offer short-term disability. Many of them are government employers or universities, they're researchers, small groups. That has existed for a long time. Those numbers go up even higher when you have your second child or second caregiving event. And then you layer the pandemic on top of it with school closures and childcare closures. And we forget about this part, but it's so important. There are over 50 million caregivers, elder caregivers in America. And post-pandemic, many people brought their loved ones into their home and are now providing full-time care. There is a caregiving crisis in America that is really challenging and where paid family leave could serve an incredible need. But we surveyed unemployed Americans just a couple weeks ago to find out what would get them back to work. And nearly 40% of unemployed Americans said they'd go back to work faster if their employer offered paid family and medical leave. We found that of those Americans who reduced their hours during the pandemic, which is a huge percentage of women, actually, this is a really unaccounted for number in that unemployment data. A lot of women reduce their hours, so they're not making the same amount of money. But they said, and it was nearly 45%, said they'd go back to work and increase their hours if their employer offered paid family and medical leave. So we have this solution to the problem that we're facing today that is just not one that many people are talking about, that I think is a really important one before we can get to the bigger conversation about where employers are at a macro perspective. But pre-pandemic, a lot of our research showed that small business owners want to offer paid family leave. It's really hard for them. It's really hard for an employer with 5 employees to find a way to afford the costs and to backfill on their own. And as you said, Amy, your statistic doesn't shock me, but it should shock me and it should shock everyone. Those employers don't know that there's a private product available to them. And most of them aren't in states where there's a state policy. Yes, there are 10 states that have paid family and medical policies, but very few of them are actually in practice. Many of them passed into law, but are not working yet. So people don't have access to the benefit. And those that are currently active were built upon often other programs that the state had before. Whatever the answer is, I believe that we need a federal policy. We need to be working collaboratively with all the key stakeholders, and we need to come up with a really complex but meaningful solution that will get paid family leave to the workers who need it most. And I think that's really hard to do, but it's not going to happen in a meaningful way if we don't come together and do it in a bipartisan way and do it in a lasting way. And we might be able to solve portions of that equation. You brought up at the beginning, our government's good at getting checks to people. Maybe that's something we can do, but it feels like it's missing a really important part of the equation. All the research shows low-wage workers, workers of color, cannot access any paid benefit if they don't have job protection. And that's FMLA. It's a longstanding law that needs to be updated. And it's like, those are complicated policy problems that I think is going to require a complicated solution.
When we think about why people left and why people need to go back, we've developed some really great partnerships across the industry on returning people back to work. So whether it's a small accommodation that needs to be made, whether it's getting someone the right help they need of what their root cause issue is on elder care or mental health and wellness for themselves or others in their family, our ability as a private industry to bring those things together should be helpful in these discussions. It should be helpful, and it should be something that we can build upon.
Well, and it should be motivating to employers, small or large, who are, as Adrienne said, trying to retain talent, and then also have that talent address the family need or the health need that they have, and then get back to work for just productivity purposes.
Yeah, so I'm gonna talk about one of them. I mean, one of them is that, and I'm my teams are guilty of it. I'm guilty of it. You know, we have, some of us are part of, you know, public companies. Some of us are private companies in terms of, we have often other folks who weigh in on what our motivations may or may not be, you know, shareholders, other things. So we start to get really picky on like, hold your ground on this and hold your ground on this, and we can't change up. I think we as an industry have to sit back. And I'm going to call it a little bit more abundance thinking, is that, you know, if truly we can make something more available for more people in a way that's really meaningful, we're all going to win. So we've got to have a little bit of faith that having something more available, even if it changes, you know, margin structures for a 6-month period of time or 12-month period of time or 18-month period of time, it's worth it to get more people covered by something that matters. So I think one of the things we've got to do in that public-private partnership is we got to give a little bit more on the private side. Now, I would say on the public side, I would love it if we could assumption that it's, you know, we're not all out to do bad things to people. And I can't tell you how quickly I get to, you need to tell me how many claims you've denied and why you've denied them. That is fine. I will give you the answers to that. That is valid. We will absolutely go there. But in the end, we're not living or dying in terms of our metrics by claims denials. We're doing it by how many people we helped. So I think we've got to believe, we got to have some faith in each other.
Senator McBride, how can we have more public-private partnerships to tackle big challenges?
I think it's a great point, and I'd love to build off Amy's comments there, because I think one of the things that we certainly need within my sphere and within my party is a recognition that we can pursue common goals. And if we're able to create a structure that achieves that goal, we should be willing to compromise on how that structure looks. There are certainly issues where we disagree on the values at hand. We disagree on the goals. I'm LGBTQ, and there's certainly fundamental disagreements that I have with certain members of the Republican Party around whether LGBTQ people should be able to get married, for instance, right? That's a disagreement on an end there. But when it comes to this kind of policy, for the most part, people agree that we should be expanding access with ultimately the goal of universal access to this benefit. And if our compromise results in achieving that goal through a different kind of structure, through a structure that has a public and private partnership, then I think we should celebrate that as a win.
Yeah. Adrienne, last word on public-private partnerships, because you really embody that in terms of how you work at the Bipartisan Policy Center.
I don't think the government can do this alone. I mean, look at SSDI as a program. It takes our government years to approve claims. We don't have any strategies to get them back to work. We haven't been able to change FMLA for 30 years. Like, we have a lot of stuff that we need the private sector's help on. And when it comes to workers in particular, they want to stay attached to their employer. They seem to value employer-provided benefits. There is a relationship there. The worker needs protections and needs power and needs the ability to, hold those employers accountable. And I think that all that is true, but they also largely want to have a relationship with their employer that includes benefits and value those benefits. And that is a public-private partnership where the government can do a lot to help serve the critical need, but help support the worker and that relationship that they have with their employer. So I think the key here is to have a multi-stakeholder process wherever we can, and to, even if something passes this year in reconciliation, to build upon it and to work together on it and to go a lot further to help our country.
Well, there you have it. If we could just put this panel in charge, I think a lot of things would happen. And I'm not saying that in any kind of facile way. I believe in all of you, and we really are grateful, Amy, Senator McBride, Adrienne, for your time today and sharing your perspectives with us and your energy and passion around what I do, going back to our starting point, I believe is a moment in time when we can get something done. So thank you for being with us.